All right, it's a beautiful Friday morning, and good morning, Nigeria. Good morning, Southeast, and good morning, Enugu. And welcome to yet another enlightening edition of Solid FM Glaucoma Awareness radio program, brought to you in collaboration with the Eye Specialist Hospital, right here in the Coal City. Today on week 37. We're diving into a very important and often overlooked conversation, breaking the silence, why glaucoma patients should share their diagnosis with their family. Glaucoma is often called the silent thief of sight because it sneaks in without warning, and by the time symptoms appear, the damage is usually irreversible. But what many people don't realize is this: glaucoma can run in families. A parent, sibling, or child of someone with glaucoma is at higher risk, yet many never get screened simply because nobody talks about it. Silence can be golden in some instances, but in the case of glaucoma, it can be very dangerous. But sharing your diagnosis early could save another family member's vision. So this morning we are privileged to have with us Professor Nkiru Kizo Akariwe, a leading eye specialist and advocate for glaucoma awareness, who is also the governor representing Africa, World Glaucoma Association Board of Governors. She's a consultant ophthalmologist with ACID Teaching Park Lane in Enugu, and she's here to help us unpack why family communication is so crucial, how to overcome the fears around disclosure, and the practical steps families can begin to take, including early eye screening and lifestyle adjustment. So stay with us on Solid 100.9 FM as we break the silence, clear the misconceptions, and empower families with the knowledge to protect their sight. Good morning, Professor Nkiru Kizo Akariwe. Good to have you.
Thank you very much. Wonderful again to be here.
Okay, now the constant in all of this 37 weeks is glaucoma.
Yeah.
So let's start with briefly reminding us what glaucoma is and why it's often referred to as the silent thief of sight.
Yeah, thank you very much, and good morning again, our listeners. Glaucoma, as we know, it's like you said, the silent thief of sight, and one very major matter about it is that it's silently, and when we talk of silently, it means it doesn't cause pain, it doesn't give any symptom, redness, and anything like that, itching, until it's about to blind the eye. So it's actually the leading cause of irreversible blindness. Now, assuming glaucoma causes blindness, and when you treat it, then you reverse its blindness, then you will say, okay, it's not a problem.
Like cataract.
Yes, like cataract. Anytime you come in, we treat you and you get your sight. But glaucoma is not like that. So you have a condition that silently blinds you, and when it has blinded you, nothing can be done about it. So the worst part of it is also that it's worse among the black Africans, and when you come to Nigeria, it's worse in the southeast, or among Igbos, actually, the Igbo tribe. It's a risk factor. So we are dealing with a condition that you might have. In fact, for the survey that we did in the country, 95 out of 100 people who had glaucoma did not know they had glaucoma. And so 95% didn't know. So as you are listening to me, you might have it brewing in your eye and you don't know. And for an average, before it blinds you, it would have been in the eyes for an average of 6 years.
6 years.
Yes, occasionally you have some very fast progressors, that is those who it progresses very fast, and it could be earlier than that. For some, is up to 10 years. In the Caucasian population, it takes maybe about 15 years to blind somebody. Meanwhile,
Okay.
all this time it's in somebody's eye. There is no pain, there's no blurring of
There's
vision,
no
there's
sign.
no itching, there's no redness, there's nothing. The person is seeing 6 6 until it's about to blind the eye. Then there is the person now has a smoky vision and feels that there is dew in the vision, and it's painful. In as much as, thank God you even came when you are still seeing something, because really it's that little thing remaining is better than nothing at all. You can with that navigate, see your food, move around, but that smoky vision there. Each time you treat patients, then they say, okay, but that smoke, can it go? And it's very disappointing to say nothing we can do about it. Yes. And so we are creating this awareness, and Solid FM has graciously granted this platform to create glaucoma awareness, because we don't want you to get to that stage where you have smoky vision. That's the point. Somebody knows that something is wrong. And at that stage, about more than 95% of their nerves are gone. So we don't want you to get to that stage, or to get to the stage where the eye is blind completely. About a third, a little above a third of our patients come in with one eye already blind. And they didn't know because the other eye was working. So that's why that's what glaucoma is. Glaucoma is a condition, not just a condition, it's a group of diseases actually that gradually, slowly damages the nerve for vision. So rays of light enter the eye, and the nerves carry it to the brain for interpretation. Glaucoma damages those nerves. And so
So I
there's
could
no
be losing my
connection,
eyes in my sight and not even know it.
and not even know it.
That's the most unfortunate thing.
Yes.
Okay, let's get into what we have today, which is breaking the silence. Many patients keep their glaucoma diagnosis to themselves.
So,
Okay, so I am a member of a family. I go to the hospital and I find that I have glaucoma, but I keep it to myself. Why is family disclosure so important from a medical standpoint?
yes. Now, glaucoma, like we've said, is a silent blinder. And those who have it don't know they have it. There are conditions that we call risk factors. That is, things that if you have, it makes you more
Yeah.
predisposed to having glaucoma. Now, when you check your risk factors and you see they are coming up in number, you're at greater risk of developing glaucoma, and it's wisdom to go and check. Now, if glaucoma is discovered early, you can prevent blindness from it. Okay? If it's detected early and treated adequately, it doesn't have to lead to blindness.
Okay.
All right. So now, the burden is to detect it early. And remember, it gives no symptoms. So who has it early does not know. Now, so why do we want family members to know? One of the risk factors, very important risk factors that predisposes somebody to developing glaucoma, is a positive family history.
Okay.
So if it is detected in one person in a family, then the other members of that family are at greater risk than the general population
Okay.
to having glaucoma. All right. So while, for instance, in like studies we did here in Enugu, we have maybe, let's say, about a fifth of our patients who, when we do screening, we pick up who have glaucoma. Now, for those who have relatives that have glaucoma, it's almost one half. Now, let me break that down. So, in the general population, about 20%, I'm talking of the southeast here, in Enugu here actually, about 20% in the general population, when you do screening, I mean, something like 16% to 20%, which is one fifth, who have glaucoma, who you will pick up either they have clear glaucoma or they are suspects. But for those who are glaucoma relatives, it's almost 50%.
Wow.
So those who have first line relatives that have it, first line relatives, talk of father, mother, siblings, particularly siblings or children, particularly siblings, is like half of them will have once you pick up
So
one person.
if a family member has it, the probability is high that some
To
other people have it within that
yes,
family.
yes, because it's a genetically connected thing. So that's why we say if you find one person who has, is a red flag for the all the members of that family. Go check, go check. A grandmother had, a grandfather had, go check. You lose nothing but it's sight saving. So we tell our glaucoma patients, even when they come in blind, I mean, it's a pity you're blind, but you could
So let's
save.
try to help your
Yes,
family.
exactly. You can save someone else from getting blind in your family. So we say if you love your family, let them know so that they can go and check. And because our people don't take checks, health checks serious, you say, Papa, leave it. Nothing is wrong
What's
with
gonna
me.
be gonna be?
Oh, I'm good. I see well. I don't even use glasses and all that. You who is the patient, you need to be on them. Be on them because you don't want what happens to you to happen to them. Go and check. The following year, have you checked? Have you checked? Go and check. And gradually they will get into the habit of checking.
So that also means that if you have a family member who has been diagnosed for glaucoma, you should also know that it's around. It's probably
Yeah, in the
around.
neighborhood.
So who exactly should be screened when someone in the family is diagnosed?
We advocate 10 years and above.
10 years and above.
Check, yeah. Because ordinarily one would say, in the Caucasian world, they say check from 40 years.
40.
Yes, because their own
They have a
glaucoma,
lower
they
risk.
have a lower risk. In Africa, we say, look, start from 30. When you have a family history, please start much earlier. Start from 10. Even if you have to check once in 5 years or 3, 5 years at that early stage of 10 years, do so. But why we don't even tell our people check every 3, 5, they will forget. So if it's a yearly routine thing that maybe you do it around your birthday time or around the World Glaucoma Week or World Sight Day period where there are free screenings, then that's where you are unlikely to forget. So that's what we advocate because we've seen a lot of young people who've lost their vision, to glaucoma.
Okay, is very unfortunate, and that means the genetic link of familial risk is high
Yes.
in Africa and also in the southeastern part of Nigeria.
Yeah.
Okay, what are the most common fears, or cultural beliefs that prevent patients from telling their family members about their conditions?
Y- You know, we started a program that where we said, okay, it's a glaucoma family program. So once you have your diagnosis and you register in the program, we we will help you reach out to your family
Okay.
members and let them know and follow them up to look, go check your eyes, go check, and then they can actually come and check their eyes for free, for glaucoma. And it gets surprising when you see people, they say, you say, okay, can we have so we can reach? They say, I will tell them myself. You say, well, okay, fine, but we can also support you. Say, don't worry.
Yes.
And you're asking, why don't you want us to let them know or to reach out to them on your behalf? And they will not give you a reason, But we believe that sometimes patients feel that diseases ought to be covered, ought to be hidden. Sometimes they are little, but these are first line relatives, so we don't know why it's a big deal, So, but they feel it has to be hidden. They feel let them not know my disability, and then some, might feel that the conditions, are, that maybe they did something to have contacted it, But we want to assure people that glaucoma is not an infectious disease. Is not there's nothing you did
To get it,
to get it.
you probably just got it because you came from that family.
Exactly. Exactly. So it's not like a sexually transmitted disease that you don't have to talk about it. No. But because you were born where you were born, and the
Probably,
way you were born.
probably family is not really as much family as they should be, because if family is really family, we should share things. We should, even
Bear
the
one
worst thing should be
another's We
shared.
should bear one
And
another's
if you
burdens.
go down with glaucoma, it's when you need your family most.
Exactly.
So if people are not, we really need to find out why they don't want to talk about it.
I agree with you.
And even if you don't want to talk about it because of your own situation, what about talking about it to help some other people to detect it early and to start treatment early to avert the condition you're in?
Exactly.
I think it speaks of love.
It does.
Okay.
It does. Yeah.
But stigma is a potent factor. A lot of people don't want to talk because of the way people are going to make them feel. You look at the way we treat people who are visually impaired in this country. We still build houses without consideration of their plight. And then, an average, no matter how kind you are, there's a way people look at those who are visually impaired. So, some people want to suffer it alone. You have anything to say about that?
Yeah, I think it's a call for all of us to become more enlightened,
Okay.
because people get blind not because they wished it on themselves. In fact, blindness is not what you want to even wish your enemy. So people get blind is an unpleasant disability, and a very limiting disability. And if anything, they should evoke compassion from us, because as they are in that world, they are suffering. They are unable to connect as much as they would connect. People who are blind have a higher percentage of depression and early death compared to others. So if it's a matter of advocacy, we are advocating that let the general public be kinder to the visually impaired. Be kinder. Know that life is challenging for them. If it's challenging for you that is seen, then imagine how it is for someone who is not seen. So let's be generally kinder, and where we can offer a helping hand, let us do. I believe that over time that will help to reduce whatever, hey, it looks like he's blind, though, and on a negative side, that will help to reduce it. And then those who have a challenge can readily, talk about it. There ought to be no stigma at all connected with blindness. None. Instead, one ought to, hey, what brought this about? So that you who is still seeing can walk more wisely. And so when it comes to glaucoma, like we said earlier, glaucoma is not an infectious disease that you caught because you went to somebody's house, or you visited somebody, or you associated with somebody. No, it's let me call it an inherent disease. You grew up and it was found, not because of anything you did. So there's no reason to be shy about talking about it at all. We've actually, a lot of patients don't have issues talking about it, more so, and we've had people who've come here to talk and advise others, and we have those who call in, who call in easily and say, I've had this problem, or it's blinded me, and all that, others. And we want to say kudos to them, because that's the way to go. Be your brother's keeper, take, be an ambassador. If you've ever had glaucoma, we want to beseech you, we want to employ you, be an ambassador, to talk about glaucoma checks. It's better found early. When it's found early, it's easier to handle, it's cheaper to handle. So if glaucoma, we can't stop glaucoma from coming, we can stop it from blinding somebody. We can stop it from blinding somebody by detecting it early and having it treated appropriately.
All right, let's spend maybe a few minutes trying to help those who are already down with it overcome this fear of stigma. And what is the best way, if I may know, that a newly diagnosed patient can start the conversation with their family?
Okay, there's no rocket science to it. No rocket science to it. Is to speak to call your relatives, to say, those who are closest to you, see, I just went to hospital, and they said I have glaucoma. And the relative might say, which one is glaucoma? Assuming he doesn't know. And then you say, they say it's a condition that damages the nerve for vision, and the damage it causes cannot be reversed. Now, what that means is that those who have glaucoma need to understand what glaucoma is. And many times the doctors would explain, the nurses will also explain, sometimes an educator in the hospital will also explain. And we want to say, just open your ears and open your mind to hear and understand what they are saying. Many times glaucoma patients, when they come because of blurry vision, many times all that you are saying, they are not listening to you. All they want is, when you finish speaking that English, just solve the problem. So, and if you now end up saying nothing can be done to reverse what is present, we can only try to sustain
What is
remaining, then that's an additional mental block. Yesterday I spoke to a patient. I said, then she will ask me the same question. I said, but I've explained this thing 5 times. He said, is there any harm in asking? I said, no, but you are not hearing me. He said, but I'm hearing you. Everybody here is hearing you. I said, yeah, your ears are hearing, but your heart is not listening to what I'm saying.
You're wishing the diagnosis.
Yes, you just block it. Almost like kind of, it's not my portion. So after I said, so what you're saying, are you saying that nothing can be, that is, so we should stop every medication we're using since nothing can be done about it? He said, no, that's not what I'm saying. Anyway, so we're saying, please open your ears and your heart to understand what the doctor is explaining, because you are positioned to educate others. And like I said, just open the conversation. I went to hospital and they said I have glaucoma, and either it is still early, and this other eye has gone is very advanced, and that they call it the silent thief of sight, meaning that somebody will have it and not know that this one that blinded me, that it has been there for some years and I didn't even know. So please go and check your own eyes and see if it is there, so it can be picked early. They say if it's found in somebody in the family, and other people in the family will have it. And I would like to say that when it's found in a family, it starts like 15 years earlier in the children than when it was picked in their parents.
It starts in the children 15 years earlier.
Yes.
Than when
it started in their parents. So you can see that with time, the onset time begins to go down. There's a family very close to me. We found it in a lady, in the who is my friend. We found it
The
in
woman
her.
of a house.
Yes, she was about 40 something years then, and and I examined her children on that same occasion. One was 11, one was 9, and I told her,
They have it?
I said the eyes look suspicious. We need to keep an eye on their eyes over the years. Please take them for checks. And then a few years after, we found it in her father.
Hmm.
Her father was in his 60s, late 60s, mid 60s at the time. And at that time, it was advanced in both eyes.
Hmm.
Hers was still like early glaucoma, and even at the time we found her own, she didn't think it was a serious thing until we found it in her father at an advanced stage. That's when she took her serious. Now, by the time her children had grown and they were in their teens, when one was 18, it was confirmed that she had.
Hmm.
Are you with me?
Yeah.
But the second one, who, there were two of them I had examined. The second one was okay. So even in her 20s, it's been checking, she's still okay. But the first one had started treatment. So at 18, it was picked. So,
Yeah, that means you can't rule out the issue of checking.
yes, you can't rule out the issue of checking. Now, assuming it wasn't seen, that girl would have been seen in her late 20s and she's lost most of her vision. Because she didn't know. No pain, nothing. But because of that family history, and the woman now took it up intermittent to take the children for checks. So that's what we are saying. That's because you love your household, because you love your family, you want to tell them about this. And we are even saying, don't just tell your family, tell your neighbors, tell your friends, tell your colleagues. Go and check, go and check. But I know that some people, where they work, especially if it's very advanced glaucoma that is affecting their functionality at work, they don't want to talk about it.
So that they don't lose their
So
job.
they don't lose their jobs. Okay, so, well, even if you don't, at that stage, you don't want to talk about it in your workplace, at least talk to your
about
family.
it in family.
Yeah.
Okay, I'd like to know, can a simple eye check detect glaucoma, or are there specific tests relatives must undergo?
Yeah, there's a simple eye test could detect glaucoma, and only when it is suspicious. Only when it is suspicious that you want to do some more exotic, some more detailed tests. So a simple eye test, looking in, checking your eye pressure, can let the doctor know, oh, there's glaucoma here or not. Like I said, if it's suspicious, so you see some nerve heads when you examine a patient's eye. It's not obviously glaucoma, but it looks like it. You know, those ones you want to run some further tests and confirm whether it is glaucoma or not. So the
Okay.
test doesn't have to be expensive. And like I said, usually many hospitals run free checks during the World Glaucoma Week, second week in March, and during the World Sight Day during the second week also of October.
Okay.
So March, October, you can check any of them.
Okay, so we have noted that we as Nigerians, we're not very big on checkups. Okay, we check up when there's an alarm already. But ideally, how often should screening be done by relatives of a glaucoma patient?
Yeah, we advise do it every year.
Okay.
Just do it every year. It's safe. It's wisdom.
But it doesn't cost time and
It
leg.
doesn't cost an arm and a leg, and you can do it during the free times. But just get it done. You
Just
know,
to make sure that once it starts, you can
yeah,
begin to
so
tackle
something
it.
you can spend because blindness is expensive. I'm telling you, it is very expensive. Is it the cost, the loss of revenue by the person who suffers the blindness because they can't go out and engage as before, or the money you have to spend on who the carer, unlike before. When the person is independent, then the person becomes dependent, and somebody just has to be around. Our society is not yet as developed
Mm.
where those who are visually impaired can be able to function independent. You were talking about like are not creating making buildings conducive yet. So there are countries where the consciousness of the visually impaired
Mm.
is so much with them that from the road you can just go into a building without any staircase. There's no depression,
Mm.
no up and downs. So, and they have additional facilities that
Yeah.
enable the visually impaired to be able to function. But it's not so with us. So or let me not say it's not so with us yet, because we are a developing country. We
Mm.
will get there by the grace of God. But so we have to now cater for each person individually, and so that's additional costs. So that money you might have, you thought you would, is costly to either do an eye check. You will spend far more if that person gets visually impaired.
All right, welcome back. It's still the Glaucoma Awareness Program, and let's get your comments. Let's get your questions. 0909 771. We have less than 15 minutes, so let's be as fast as we can be. 0909 771 1009. You can also dial the next number, and that's 0704 550 2840. 0704 550 2840, or 0909 771 1009. Okay. Okay, just before we get some calls, how often, okay, I think I've asked that question. So, what message do you have for listeners who may be afraid or hesitant, to share their diagnosis?
I would like to encourage our listeners, as you are listening to us. Maybe this might be your first time, or this it's you are a regular listener of
Mm.
this Friday. We will want to say, ask, have you checked your eyes? If you haven't, please go and check. Don't postpone it further. Don't keep saying later. They say that procrastination is a thief of life. Please don't postpone it. Go and check. Just put it in your priority list. Just go and check. Once you've done it, then you tick it off. And then if you have checked and you don't have it, rejoice and encourage your neighbor to go and check, because you have heard of this. That is care. And if you were found to have, then be a bigger ambassador, evangelist, announcer. Tell your neighbor, tell your family members, because it means that they are at risk. Tell your friends and encourage them. Don't just tell them, encourage them to go and check. Once a year is good. Once a year is good, and it doesn't cost much. It doesn't take much either.
Okay, for those of you who are listening, if you want to join our Glaucoma WhatsApp channel, you can send Glaucoma, that's Glaucoma, to 0810 435 8093 on WhatsApp so that you can be added. Hello, good morning.
Good morning,
Yeah, good morning. Step away from your radio.
Mr. Uche.
Yeah.
Yes, Onoja from Kogi.
Onoja, how are you?
Thank God.
Go
I'm
ahead.
so much encouraged by Madam's speech and advice. Where in the hospital should I go? Is it eye clinic in the hospital or where?
Yes, the eye
Say,
clinic in a hospital.
pardon?
The eye clinic.
Okay, thank you.
Okay. Where exactly do you stay?
Okay.
Okay. I'm sure he's calling from Kogi State, so I wanted to know. Okay, but keep the calls coming, and let's get your inquiries. Hello. Good morning.
Good morning.
Good morning,
This is just that last week.
Esther. How are you?
I'm fine.
Okay.
Now the radio off. I didn't hear what the doctor said,
You.
and I want to add that early this year, my younger brother started having this reddish eye. So it's very painful. So they went to the hospital at Calabar, but they checked him everything. They told him nothing. He was asking, "What is wrong with me now?" The doctor said nothing. They referred him whether to another hospital, or they say he should come back. So I don't know,
you
because they checked him and they say nothing.
earlier you said you didn't hear what doctor said. Which of the doctors?
No, that last Friday,
Okay, last Friday. What question
okay,
did you ask?
I told you that I was sick when I became sick. So that very day, I started seeing smoke. And anytime I come, I don't see it today. I
You
don't.
see smoke.
Yeah, it's just like smoke covered everywhere.
Okay. You had an accident?
No, no, no.
So how did it start?
Uh, I was traveling to the village. I was not sick, but I started developing this weakness before the next day. To wake up, I was so weak. All of a sudden, it just happened. I don't know, they took me to the hospital.
And it started
Before
affecting your eyes?
they treated me, it was normal sickness, but today I'm not really okay.
From that
It's
time?
not, yes, so
Have you
they
gone to an eye clinic?
no, I'm not going to
What
any
are
eye
you
clinic.
waiting for?
No, it's not only the eyes, that's why I'm confused.
Ah?
If not, it's not only the eyes, the whole of my body. I can't even walk on a bad road as I am now. I don't go out, don't come out of the phone.
There are systemic conditions.
Okay.
There are systemic conditions that affect the eye. One of them is multiple sclerosis, which can also affect how somebody walks and all that. So it's a serious condition that she ought to go to a teaching hospital. There are certain conditions that are more than what maybe a nearby clinic can just handle.
I don't know.
Mm.
I don't know why, but you see, she will be quicker to treat malaria than to treat that blurry or whatever vision. And I don't know. That was why I was asking.
Yeah,
Okay,
yeah.
but tell Manya before. I mean, you don't even understand that one
It's
is
a
scarier.
serious, yes,
It's
it's,
more
it's a
serious.
serious matter. Something that
If
it has immobilized you,
yes,
that you can hardly move around. So it means that she can't even function. Then whatever resources you have, whether human or or financial, mobilize it, raise an alarm, so that they can take you to a hospital where you have specialists,
mm,
who can evaluate and know exactly what is wrong. A problem is that many times when we don't understand things, and why should you understand something when it's not your field? Some people are trained to understand different diseases. So go to them. So but many times when it passes, we think that malaria and typhoid are the only diseases in this world, and if it's more than that, then it must be a spiritual attack. I mean, it can be a spiritual attack, but manifesting medically. Let us go and find out the medical diagnosis of it, because there might be a medical treatment for the condition, and then you can be well.
First of all, find out what the problem is. Please go get the diagnosis. Go to the hospital.
Very important.
Very, very important. And like we announced earlier, okay, let's take this call. Hello, good morning.
Yeah, hello, good morning, sir.
All right, good morning.
Yeah, it's me. It's a Kama calling you from MN.
All right.
Yeah. Me also with my own eye is disturbing me very well. At the same that smoke while they see far, I know they see far.
How long has it been?
Since why I enter problem, why I enter, get the time where army people catch me, say I pop. They keep me in a cell in a guard a year and 6 months.
Okay.
So from that time I developed that thing, because where they keep me, I know they see light.
Okay.
Only gare with the chop there, drinking and chop dry gare and all those kind of things. And now this year, what we say that thing happened on 2023 August 11. Now this January 2025, where they release me, that's first.
Okay, so it's affecting your eyes.
The thing is affecting my eyes.
Have you
and
gone?
I don't go. Yes, I have got check up.
Okay, and what did they say?
They say they don't see anything, because after they put me the spec where they put, I don't see any other thing. At the same time, why they see what they see. They put another one, add another one at the same time. They can't tell me, say my own eye, no go issue. I need to go orthopedic or anywhere. So since then, me, I never go that side, sure.
Orthopedic to do what exactly?
I don't know how they just tell me, say, I go there, I go explain, give them. But say they don't see anything for my own eye. Say, nah, maybe, I know what they say, nah, that guy and that, only that place where they keep me, where they engage me, where I know they see light.
Okay.
Yeah. I
All
would
right.
like to say that.
Yeah, go ahead, Prof.
Yeah, that
Just listen to Prof.
if you're an adult and you're put in darkness for 2 years, you will still see when you come out, because your eyes have developed ability to see
In the dark.
in all for life.
Okay.
Yes, so you won't lose your ability to see because you were kept in the dark. Now if you are malnourished, because if you are malnourished, it will not also affect your vision in the way that he's talking about it. So there are different types of places. Please go and see a specialist to examine your eyes and know exactly what the problem is. The problem has not yet been diagnosed. There are different categories of eye care personnel. There are those who fix glasses, like who are called opticians, and they are, they also have clinics. They also have shops, and all that, optical setups, because they fix glasses. You can go there and pick frames and have your glasses fixed. And so sometimes someone on the uninitiated will think that it's the same thing as
We're saying an
I have seen a
ophthalmologist.
doctor, an eye doctor. Okay, and apart from the opticians, we also have the optometrists, who are scientists, okay, who provide primary eye care. There are also certain diagnoses and pathologies they won't be able to elucidate because it's beyond their level of training.
Yeah.
Then you have the ophthalmologists, who are doctors who specialize in eye care. So that's the top of the pack. So when you have an eye condition that you don't understand, please see an ophthalmologist for a proper diagnosis. And then once that is done, you can now decide at what level of care you want to continue.
All right. Time is almost up. Let me take the last call. Hello. Good evening. Good morning.
Good morning.
Hello.
Hello, good morning. It's Esther calling back.
Okay.
Doctors, I have gone to the hospital, not one, not two, to specialists. Finally,
What's
I
it?
just,
Which hospital is that?
I'm in Uget, or the hospital around Uget. I've been to the hospital in Inugu. So every effort, first they thought is partial stroke. They treated, as one of the doctors says BP. He treated, even referred me to brain scan, which I even, because of the health, I still went. Nothing. So every effort, that is why I did not even look at the eye, because one of the doctors said I should go for eye checkup. I said this thing happened the day this sickness starts. So for 8 years now and 8 years plus, I just hand over everything to God. But I'm just,
You're handing over. Have you done the eye checkup?
it's just the eye checkup. That is why I'm asking.
Have you done the brain scan?
Yes, nothing.
So why is it that you're finding it difficult to see an eye doctor when your eye is obviously affected? Do you want to lose the whole of your sight? You don't sound like it's easy for you. Imagine when you now lose your eye, I mean your ability to move around. Doc, let's just 1 minute. Our time is up.
Okay, thank you, dear listeners, for being with us again this Friday. And please, we request that you help to propagate the message we've tried to pass across this week, to have your eyes checked and tell your neighbor. And if you already have a diagnosis of glaucoma, please tell your family. It's not a private diagnosis. If it's affecting you, it will also affect some other members of your family. Please inform them to have their eyes checked regularly. Early diagnosis of glaucoma and prompt and adequate treatment prevents blindness from glaucoma. Be your brother's keeper.
Thank you, Professor Nkiru Kizakariwe, consultant ophthalmologist, ASUT Teaching Hospital Park Lane, and the governor representing Africa, World Glaucoma Association Board of Governors. Thank you for all you do. Thank you for the questions you've answered and the clarity you've brought to this conversation. And to those of you who listen, let's do it again next Friday.